Hi, Dr. Joe here to talk a little bit about changes in personnel that are happening within the framework of medical care. As everyone seems to understand, we're about 250,000 doctors short, but that shortfall is not a big deal because we have been training other people for a long period of time. In the past 20 years or thereabouts, we've seen a big increase in something called the physician's assistants. These are people who've gone through special training. There's now, as I look, the number recently is 74,000, a little over 74,000 people actively educated, actively working in the healthcare field. So there's plenty of them, at least for the recent intervals that we think would be available to anybody. Nurse practitioners, again, specially trained nurses to be in a very helping way to really do personal health care for you. The third is just plain registered nurses. When I say just plain, that's not true. The nurses that are out in the world who work in hospitals and leave those positions are becoming expert nurses. These are people like we have. You all know Evelyn, you all know Penelope. They've been with me for 17, 15, 19 years or so, and they're in a place where we know that they are just as good as anybody I've ever seen. Because what we did 20 years ago, we began to say, look at how we become something special in the high-tech world is through education. So that what we began to do is say anybody who works in this office will have special education. It's not so much the people in the business office, but anybody who's dealing with patients has had a lot of continuing education is what they're able to do. So what we have done and what we're doing more in terms of our pursuit of teleconferencing will be in a place where people can feel comfortable and they will know it because the way they feel they will be introduced to new technology will be very apparent. And you'll find that as we go and train new nurses, in addition to those I've mentioned, they will be just as good as all the rest. So what we have now is a way to make people understand they're getting more care than they did before. That is really very important because just as I talked about how the pharmaceutical companies are coming into the offices to train, yes, this is to augment everything we're doing as well. This is a new and really wonderful period of time. You will learn so much. You'll be such an expert on whatever you're worried about, and you'll be given all the handouts, every other thing that you'll need to know to make everything good for you. Because really, as we go through these things and you know everything you're supposed to know about your health, staying healthy, it really is your time.